Good evening. My name is Dr. Abiola Olusegun, a herbal medicine practitioner in EMBEE Holistic Care. It's good to be here once again today, because I told us yesterday that we are going to discuss a topic, and it's actually a bit serious topic, which is how to recover from mental breakdown. I told us yesterday, after yesterday's lecture, that we're going to discuss that today. So please, I will implore you to listen attentively, follow us as we are discussing this, because you can actually be of help to someone in need. And I will implore you that after this lecture, you should like and share the video so that other people too can benefit from it, because this topic is affecting so many people. In fact, there are some people that they don't even know that this is what is actually happening to them. They won't know until it becomes something that they won't be able to control anymore. So if you share the video, it will be of help. You might be helping someone in need. Now to our topic: how to recover from a mental breakdown. How to recover from a mental breakdown. Now, a nervous breakdown means that mental health crisis that occurs when a person is no longer able to cope with stress or pressure. Stressful life events may trigger a breakdown, but underlying mental illness can also cause it. So it is when someone can no longer cope with stress or pressure, that is when you can say the person is suffering from nervous breakdown. And a nervous breakdown may cause intense anxiety. It can cause depression, it can cause moodiness, it can cause physical symptoms and inability to keep up with normal activities such as work, hygiene, and to manage relationships and so on. So a breakdown can be treated and prevented with therapy and self-care. Now, a nervous breakdown. That term nervous breakdown is not precisely a medical term, and it is not the name of a specific mental health condition, but it is used to describe a mental health crisis, and this can also be called mental breakdown. You can also call nervous breakdown mental breakdown. And during the crisis, the person that is undergoing this feels intense stress. The person feels anxiety and other negative emotions. The person is unable to cope with stress and emotional demands, and this leads to disruption in day-to-day life and functioning. So a nervous breakdown is not a healthy way to cope with stress. What causes it can be different from every person, and severity of the crisis also varies by individual and incidents. So what causes it in Mr. A may not be what causes it in Mr. B. And severity of the crisis also varies. That also matters. So the term nervous breakdown may be used casually to describe anyone that is not coping well with stress. But when this really happens, it can genuinely feel like crisis to the person that is experiencing the breakdown. And it may even constitute a mental health emergency and require treatment from mental health professionals. And in some cases, it requires a hospital stay or residential treatment. Is that they admit that person in the hospital, or they come to treat the person at home. So a breakdown often means that there is an underlying mental illness, like an anxiety disorder. Anxiety disorder is when you have feelings of worry or fear. So a breakdown often means that there is an underlying mental illness, like an anxiety disorder, that needs to be diagnosed and treated. So if you see someone that is going through all this, you know that maybe that person is going through anxiety disorder. So you can help that person. You know that the person needs to be diagnosed and be treated. So there are several different types of nervous breakdowns, but it isn't always easy to be aware of one's own mental state, especially in the middle of crisis like a nervous breakdown. So it helps to be aware of the symptoms, to be able to recognize them in oneself or in loved ones. And the symptoms vary by person. So anyone going through a mental health crisis may experience a few or more of these symptoms I'm going to mention. They can have feelings of depression, sadness, or hopelessness. They can have severe anxiety. They can be feeling socially isolated. They can be feeling detached or not like oneself. They can be experiencing hallucinations. That's a perception of having seen or heard or touched or tasted or smelled something that wasn't actually there. As in someone like seeing something that is not actually there, or hearing something that is not there, touching something that is not there, tasting or smelling something that is not actually there. That's what we call as hallucination. And they can have emotional outbursts or extreme mood swings. They can have paranoia. That's a sense that someone is watching or following you. When you are going, you feel like someone is watching you or someone is following you. They can be experiencing flashbacks, or that is when they have once had troubled events, so they'll be having the flashback of that event. Or they can be experiencing difficulty concentrating or thinking, and they can be experiencing thoughts of suicide or self-harm. They feel like they should harm themselves. So another very important indication that someone may be going through a nervous breakdown is an inability to function normally. This can take one or more several different forms, like missing a lot of work or school, or performing poorly in school or at work, avoiding social situations, not keeping up with personal hygiene, missing appointments or other responsibilities, staying home and being isolated, not cleaning or maintaining the home. So all this can also happen in several different forms. Someone that is undergoing a nervous breakdown. So a nervous breakdown can also cause physical symptoms, and a person going through the crisis may have a panic attack, which causes extreme fear and anxiety, as well as chest pain. The person can be feeling chest pains, tingling hands or feet, and difficulty breathing. So a breakdown can also cause high blood pressure. It can cause dizziness. It can cause indigestion. It can cause shaking. It can cause insomnia. It can cause aches and pains. It can cause fatigue. It can cause exhaustion. So there are some early warning signs that you can actually see in someone that you will know that yes, this person, maybe the person wants to go into nervous breakdown. So there are some early warning signs you see in the person, or maybe you are the one that is undergoing it. There are some early warning signs you see for you to know that you should be careful, that you might actually be experiencing a nervous breakdown. And a nervous breakdown is usually triggered by something. It doesn't just come. It is triggered by something or several things. And stress can be number one. It can be triggered by stress. So a person going through this kind of mental health crisis have reached a point of being unable to cope with stress or anxiety or depression and other negative emotions. So there can be signs that a breakdown may be coming, that a breakdown wants to happen. And when you know all this, recognizing them can help someone take charge. It can help you take charge of the breakdown. So when you are noticing all this, you quickly ask of help, and learn better ways of coping to get back on track. So there are some potential early warning signs that someone may be suffering from nervous breakdown, and this is when the person is not functioning or maybe functioning at work or in school or at home is declining in small ways, such as poor performance reports, a bad test, or more fighting in relationships and ignoring, because there are some people that they ignore house calls. So these are early warning signs that the person is going through through a nervous breakdown. And there are some that feels unusual or new feelings of depression or anxiety, changes in appetite and weight, changes in thinking, like an unusual difficulty focusing on tasks or remembering things, or being uncharacteristically unorganized. So there are some people that increased use of alcohol or other substance abuse as a way of trying to cope is what is showing that they are going into nervous breakdown. And there are some that you see that they are lazy in their appearance or cleanliness. There are some people, they feel a lot of pressure, and some feeling like life is just unmanageable, like they cannot manage life, or they feel overwhelmed. So these are some signs that, or symptoms that someone is going through a nervous breakdown. And it has some causes, or the general cause of a nervous breakdown is stress. Stress is just the general cause, because it is when someone cannot cope with stress anymore. And when it is not even possible for you to cope with stress again, that is what can trigger. It is number one cause of nervous breakdown. But however, there are many different things that can lead to breakdown in each individual. This can be external factors like stressful or traumatic events, or they may be internal, such as depression or an anxiety disorder. And there are some examples of what may cause, trigger, or increase the risk of a nervous breakdown. And this includes increasing stress or pressure at work. That's why I always tell people, please manage your stress. Manage your stress. When you go through too much of stress, it releases a hormone in our body, which is cortisol. And cortisol can cause inflammation, and this will result into so many diseases in our body. In fact, it weakens our immune system. It causes so many things. Stress causes heart attack, it causes stroke, it causes high blood pressure, it causes insomnia, it causes low sex drive. So please manage your stress, please. And this is what we are saying again, that stress is number one thing that triggers a nervous breakdown. So when you increase stress or pressure at work, it can lead to nervous breakdown. It can cause it. Stress at home, difficult personal relationships, these are part of the thing that causes nervous breakdown. A traumatic event. There are some people when they are involved in a traumatic event, like a loss of a loved one, or a physical assault, or genocide, where they are killing a large number of people, maybe in a community. So this traumatic event affects some people, or maybe when they are in a crime scene, or when they are involved in a fatal accident, it affects them. That traumatic event affects them. It can make them go into nervous breakdown. And a big life change, like a divorce or move, that can also cause nervous disorder, or an injury, or recent diagnosis of illness, or financial problems. These are part of the anxiety disorder, major depression, or any untreated mental illness. These are the things that can make someone go into nervous breakdown. And sometimes the causes of a breakdown are multiple. It may be difficult to pinpoint the exact one that triggered the breakdown. So it may just be mounting stress from being overly busy, or it can be one defining event like a trauma. So everyone responds differently to difficult situations and stress. And what triggers a breakdown for one person may be something that another person can cope very well with. So it varies in different kind of people. What you can cope with might be something that will cause a nervous breakdown in another person. So there are some diagnoses of a nervous breakdown, but though there isn't really a diagnosis for a nervous breakdown, because it is not a medical term or a specific mental illness. However, when someone experiences this situation, it may be diagnosed by a psychologist or psychiatrist as a general mental health crisis, or as a mental illness that underlies the crisis. So common diagnosis for someone who has experienced a mental breakdown are anxiety disorders, major depression, and acute stress disorder. So treatment for a nervous breakdown may involve therapy. It may involve medications or self-care or lifestyle changes. So working with a therapist can help someone manage negative emotions and explore the causes of those feelings and change your thoughts, change your behaviors to minimize stress and better cope with it. So a therapist can also teach someone healthy coping strategies and relaxation techniques to manage or prevent another breakdown. And in some cases, medication can be prescribed to someone who have had a nervous breakdown. Well, this is most likely if the person is diagnosed with an underlying mental health condition. So, for instance, if the person was diagnosed with depression, there are some antidepressant apps that may help manage the condition that can prevent future breakdowns. So, for people struggling with anxiety, anti-anxiety medications may be useful, and there are several apps that serve as anti-anxiety medications, and they can all relax the nervous tension and reset the neurotransmitters for normal functions of the body. So other nervous breakdown treatment are self-care and your lifestyle. So anyone who have experienced a nervous breakdown should consider making lifestyle changes and engaging in better self-care to help eliminate and manage stress. For instance, a change of job, ending a stressful relationship, or cutting down on responsibilities or time-consuming activities. This may reduce the pressure and stress that builds up to a nervous breakdown. So, in addition to making those changes, a person who have not coped well with stress in the past can benefit from good self-care, like socializing more with friends and family. Social support is crucial for managing stress or mental breakdown. Or you get more physical exercise. Physical exercise is a great way to reduce stress. You practice relaxation techniques like meditation, journaling, or breathing exercises. Eat a well-balanced diet. Get enough sleep every night. Take time to do enjoyable activities. So spend time alone if needed, and read the holy books suitable for your religious beliefs. You avoid triggers. Avoid anything that that can trigger your mental breakdown. Stop listening to news or engaging in activities that will make you feel more tense. You can listen to comedies. Comedies may help. And aromatherapy, which is soft tissue massage, can also be of help. So if circumstances allows, you can also travel for a vacation. You can go to beach, go to mountain sides, go to zoo, and so on. This can also ease your nervous tension. So, a severe and acute nervous breakdown may become a mental health emergency that requires hospitalization or residential treatment, and it will be immediately. But this is especially true if the person is already having thoughts of self-harm or suicide. A panic attack can also feel like medical emergency with a lot of the same symptoms as heart attack. So it is important to get immediate help when experiencing these things. When you know that you're already experiencing these things, get immediate help. When you have observed it in someone else, please get immediate help. So there are some further steps to take during a mental health crisis. You reach out to talk to someone, such as a close friend. Don't close your mouth, please. If you know that you're already observing these things, reach out, talk to someone, talk to a close friend or a family member who is in position to help, someone that can help you. Please talk to them. And you can also call a trusted doctor or therapist for advice. Let your doctor know that this is what you are going through, so that your doctor can help you. There are some numbers that you can also call. I think there are some numbers that they call for emergency cases like that. And let me add this, because I'm pained and sad towards those who have lost their lives and physical health due to the ongoing rest in the country. There are more to events like this than most of us actually thought. It has happened before in Nigeria and other countries, and it is still happening right now in so many countries. There are evidences that shows that it is all beyond human capacity to provide real need or lasting solutions to needs of fellow humans, the rule. So it is time we diagnose ourselves spiritually to know if we are on the right path, if we are with the right knowledge, if we are with the right way, if we are with God, because that is the right way. And it is only God Almighty that can really remedy our problems permanently. Because health is a total state of physical, mental, social, and spiritual well-being, and not just in absence of infirmity or disease. So if one is not healthy spiritually, the person is also ill. So please keep safe and stay calm. This is where we are going to end our lecture today. So as I said before, I implore you to share this lecture so that you can be helping someone that is in need of this. It can be of help to another person. So we'll meet next week to discuss more. And if you have a question, you can message us directly on Facebook, and you can also follow us on our other social media platforms on Instagram, EMBEE HOLISTIC _CARE. You can also reach out to us on 081-0460-7130. Or if you want to speak with a doctor, you can also call that number 081-0460-7130. And you can also visit our clinic at number 51 Abiodun Oshudiya Street, Meron, Agbado Jaye, Lagos. So see you next time. Bye for now.